I thought it would be helpful for OT students to make a general video about how to prepare for acute care specifically. This information might be applicable, I'm thinking, to other settings as well, such as acute rehab and skilled nursing, but I'll try to make a separate video series for this as each setting has its own specifics. And I don't have any specific experience so far with skilled nursing besides my pre-OT shadowing, so I hope that I'll be able to bring a guest on to share this with you, especially since they have had more experience in these settings. But if you guys know anyone in the comments who would be good candidates, let me know so that we can bring them on. While this is intended mainly for level 2 fieldwork students who are expected to demonstrate competency as a generalist OT, this video is a good preview for level 1 fieldwork students as well, to see what you probably need to prepare for when it comes time to do your level 2 fieldwork. And if you're new to this channel, my name is Jeff, a board certified and licensed occupational therapist practicing here in America. A common misconception is that occupational therapists help people to find jobs, but instead, they help people to do the things that they want to do that are meaningful to them. My goal is to increase awareness about the profession of occupational therapy to help people live healthier and happier lives. If this resonates with you, consider subscribing to this channel and joining to be a member. Check out the video description for other ways too that you can support this channel. I'm Jeff, the OT Dude, and let's get functional. So acute care will take place in a hospital. And one thing that differentiates one hospital to another is, for example, the level of care that they can provide. For example, a level 1 trauma center is the most comprehensive in services that they can provide for the care for their patients. So they can take care of almost all emergencies especially. So this is what it means when you see, say, level 1 versus level 2 and what the difference is, just a broad general difference between the hospitals themselves. Of course, each has their own, say, more specifics in terms of like the rules and regulations, what units they have, but that's beyond the scope of this video. Most patients enter the hospital system via the emergency room from, say, EMS services, or they may self-admit themselves to the emergency. And there is actually, sadly, a growing trend of people being unable to afford the EMS service, such as an ambulance, and having to call other private transport, such as Uber and things like that. And this can be very risky because these personnel, drivers, aren't trained like the EMS professionals are. And what some OTs may do is they may see patients in the emergency room for, say, quick screens if there's an order for OT. But this OT is kind of like really quick and discharge, like quick and dirty, so not as involved as in the rest of the acute care settings within the hospital. And another broad categorization of patients who enter the hospital are acute trauma or for medical, either acute or chronic, so traumatic or medical. There of course could be overlap, like one patient may have both, but there's usually one main reason or what occurred first. So if it was like a heart attack while someone was driving a car, the heart attack would precede it and be the main reason. Or if someone had a car accident, so it's traumatic, they may have a medical condition, like an underlying chronic one, that may exacerbate because of the traumatic. So that is an example of a second situation. So based on these two kind of categories, the patients may go to the respective department, or they may even go into surgery if it is something more serious, such as cardiac cause, like a heart attack, for example. But a common place that they may go for very serious things is the ICU. And this is the most acute, as in the medical stability, that the OT would often first encounter the patient. I won't go into the ICU side of things, as you likely won't experience this, especially in the very beginning for level 2 fieldwork. You'll probably start in other units in acute care, as this is considered a more specialized practice area, the ICU. Units that you'll commonly find within the hospital include neuro or neurology, cardiac or tele. Sometimes these may be separate or combined. And there's also remote tele, which means that there is some cardiac issue that is being monitored remotely, like a box that is hooked up to their leads, but they may be in another unit, not necessarily a cardiac or tele unit. And there's also general medical surgical or med surg, which is really a catch-all for diagnoses that don't fall in other unit categories. So, or if there are, say, no beds available. Sometimes, depending on the hospital, psychosocial patients may be located in med-surg, or there may be a dedicated psychosocial psych unit. And there's also oncology and palliative, or for hospice. Sometimes these may be combined as well. And so far, the units that I've explained are just mainly the adults and geriatrics, but for pediatrics, there's generally their own units, such as the NICU. And there's also, I think I forgot to mention, orthopedics too. Some hospitals also have a step-down unit. The PACU is also a similar unit, and patients come out directly from surgery from the PACU. Some hospitals also have maternal wards and women's health for, say, pregnancy. And also some hospitals may have rehabilitation units like the ARU, Acute Rehabilitation Unit, which is considered different than acute care. So it's acute care and acute rehab, ARU. And last, some hospitals may have more long-term cares, kind of like skilled nursing facilities, but they don't call it that. And it's mainly for patients who may have extended lengths of stay for reasons such as lack of insurance, chronic conditions, or any other reasons that may not warrant them for a quick discharge. Other complications and things like that just back to back that make them kind of a high risk for going into the community or other settings such as even the skilled nursing facility. I won't go into the examples, but it's pretty straightforward. For neuro, you'll see things like stroke, TBI. Cardiac is obviously like cardiac conditions like a CABG from a myocardial infarction. Respiratory, it'll be like for respiratory reasons like COVID-19. Oncologies, cancers of the body from anywhere, mainly, and it's the main diagnosis. There may be other comorbidities and other chronic conditions underlying it, but mainly it's the cancer. And for what other units are there? Ortho, it's usually from traumatic accidents. It can be chronic as well. So one way to differentiate it in orthopedics is elective surgeries and non-elective surgeries too. So sometimes there may be a surgery that's elective, such as like a hip replacement, a knee replacement, something like that. If it's non-elective, then it happened because, say, from a car accident or a fall or like a workplace injury and things like that. As mentioned earlier, general med-surg or med-surg is for like catch-all for the rest of the patients who don't really fall into it. Or they may not have like a specific diagnosis and it's kind of unclear too. It may go there as well. I thought it'd be kind of fun and interesting to cover some of the other miscellaneous units that OTs may venture in or may encounter or may need to work in these specific places, or more often than not find things in these places. So number one is the kitchen in the miscellaneous list. And you sometimes come here actually and to grab things like food for special diets, say for patients on a cardiac diet, low salt, or they may have other like allergies or whatever. Or it may be more physical problems such as dysphagia, or it could be cognitive as well. So you may come here to grab, say, different specific foods that aren't deliverable on a tray or weren't delivered in time. Or you may be special ordering it. If you're doing things like a meal prep, such as IADL meal prep activity, then you may have to come to the kitchen to pick things up. And it depends on the hospital system where you work. Sometimes you as an OT may keep the adaptive utensils in your own unit or in your own place, or may have to go through the kitchen. So this is why you may actually have to visit the kitchen and return things or grab more things. Then there's imaging, and this is where patients may go for, say, MRIs and x-rays like that. And these days, actually x-rays, they're often done on a mobile x-ray unit that can be wheeled into like the patient's room by their bedside. But you'll find other things like CT, other larger equipment. And sometimes these are not located like in one unit themselves. They may be scattered around or even like outside on a mobile, what do you call them? Like a mobile, I don't know what you call it. And of course, these things that you get come from a central place, like a supply distribution center after they're offloaded from the trucks or they're stored somewhere in the hospital, right? And you may actually come here for larger objects, such as TLSOs, for example, or large braces. And these items need to be picked up by hand because they're so large. What's also really neat is that in hospital I work, for example, they have a tube system. Kind of, if you went to like Costco or was it Price Club a while back, they had those tubing systems like by the cashiers and like in the ceilings where they like, I think they sent checks there actually. I'm not quite sure. Probably some payment, I would think, or receipts. It's a very similar system they have in the hospital where you have these actual like canisters and they're like hard plastic and they remind me of like a submarine like missile or something. But you can place a lot of things in there like forms, hand braces, like for hemiparesis, I fit like slings in there, or I've had the person delivering it anyways, send me it in there and shoot me these things via this transportation system. I don't know what you call it, but sometimes things such as TLSOs are like larger than that. So you'll have to go to central. And what you typically do is you call them up and tell them, hey, like, I'm coming here to pick this up. Do you have it? And can you put it up on hold for me? So that it helps to give them a heads up. So when you go there, you don't be like wasting time and they say, oh, we don't have it and we need to reorder some more. But this is also another method where you may call them and they'll shoot it over to you. Of course, each hospital has their own system. So it depends on the policies and how things work where you work. But if you have these tube systems or you've seen them around, they can be used for OT. And depending on where things are stored in the hospital where you work, say for looking for wheelchairs, walkers, commodes, common things that you would get as an OT and as a PT, some of these things may be located even within the same patient room. Some may be within that unit. Some may be like next door, like maybe further away. So it really depends. So this is why it takes a lot of planning and thinking. Like when you go see a patient and you do your chart review, they say maybe for an evaluation and they may be unsteady on their feet, then you may be thinking about grabbing some things like a walker or a wheelchair, especially if you're the first therapist to work with this patient, especially to mobilize them out of bed after they have admitted. And depending on the hospital where you work, sometimes these things go with the patient. If they were to do a room change within the hospital, sometimes it stays there. And in which case you would have to get new equipment when they switch units, so to speak. But when patients switch units, what typically happens is they typically get to stay in their bed if it has like wheels and it's not too far, like they don't have to go across the street and their belongings coming with them. But they don't have to like change beds even, and that's kind of cool. But sometimes they may change beds too, so they may have to go onto like from a bed, like a hospital bed, to a gurney, which is like more mobile and more narrow and meant to really roll around. So far, it sounds like you'll be walking around in random rooms a lot too, right? So a lot of these rooms are locked by a keypad. Like you punched in the code, like a 4-digit code or something like that. So there will be a lot of codes depending on where you work. But in general, you'll have like units each have their own code that they like to use. And you'll have like a lot of codes to be familiar with. So what I recommend, pro tip, is to carry around like a small notebook so that you can write these codes down in it. Or you could store it on your phone if your clinical instructor allows you to do that. But typically I would stay off the phone as a student so there are less distractions. It looks more professional anyways. So a notebook is a good alternative. Then there's of course the Rehab Office, and you may come here say in the morning for morning huddles to get your assignments for your patients. You may do charting here in the middle of the day or at the end of the day. You may do more administrative tasks such as printing your productivity reports, etc., or when checking your email too. And nursing units. This is kind of self-explanatory and obvious, but each unit typically has their own nursing unit and they're spread out throughout the hospital. You may call a certain unit, and this is where you would usually call like a nursing unit to talk with, say, the nurses there. And typically there is a lead nurse. There may be a resource nurse, which kind of helps out and does like break and relief. And you have the nurses that have their own specific list of patients that they are responsible for. And each unit Typically they have like a whiteboard or whatever board. Sometimes they're digital now too, actually. That's kind of nice. Of who the lead nurse is, which nurses are on in that unit, whether some of them are on break or not, what their patients are. That's typically they're laid out and shown on this board. And also, what else I gonna say? Oh, there are extensions too. So you can write that down in terms of like the numbers that if they have a phone on them, you can page them or phone them. Depending on where you will do your fieldwork, the culture, sometimes nurses like to be called and ask questions. Sometimes they don't. Sometimes they prefer in person. So you'll often, as an OT, also work with social work, talk to case management. So where are these personnel located? Oftentimes they're kind of, I feel they're just scattered around, or they try to find a computer that's available. And so they may be at a nursing station. Sometimes they have their own little offices too. So like a unit may have their own dedicated space. And here you'll find the nursing staff. You'll also see who else. What was I just talking about? Oh, case management, social workers, and doctors, of course, and doctors' assistants like PAs and nurse practitioners. They'll be all fighting for a computer. Sometimes you'll see pharmacy too, and other staff like administrative, management. But besides these typical places, you'll also have more administrative places like offices, and there's also management offices, medical records. So patients would go here to pick up their medical records, say for a family member or for themselves. There's also janitorial services, and this is sometimes called EVS, environmental something services. I'm actually not sure. Maybe E is for environmental. Anyways, you'll actually sometimes go here too to pick up some things like random, like garbage bags. I like to grab garbage bags sometimes, say to wrap up patients for a shower, or you'll maybe grabbing other things that patients may need replacements for. Like sometimes they have like emesis bags at the side table, and if like a patient has other needs for more of them, or sometimes they're good storage bags for other things, or sometimes even towels. I've seen come to find that some towels are located in the janitorial room. So good to know where this is, because they have a lot of goodies actually. If you're allowed to go in there, at least. You don't want to make any enemies, of course, especially as a student. So with all these, it may seem overwhelming, like all these places to be familiarized with, but don't worry, you'll kind of get the hang of it once you work there, and you'll have to go through it day by day. So don't worry about like memorizing a map or something like that. But one pro tip is especially to learn where the staircases and stairs are, not just only where the elevators are, because, well, elevators are typically very slow. Sometimes you may have to share them with the public, but in some hospitals, personnel have their own elevators, but still, it's typically a long wait time. So stairs are good to know, of course, because of emergencies, and if there may be a fire, you're not supposed to use the elevator, right? But also because they're fast, and it's good exercise too. So you'll learn your way around and learn some of the more of the shortcuts too, and this is where you may find some interesting places, like the morgue. You'll get an orientation, I'm sure, but familiarize yourself also with things like where the emergency exits are, where the fire extinguishers are, where the chemical wash stations are, like the showers, things you pull on, or the eye wash stations, where certain documentations are, like the chemical spills book are, things like that. Because while you're not necessarily going to be asked these questions by like JCO when they come around, it's just a general good thing to know for safety, especially when you're working in the hospital. And I also made a video, I think, yeah, I did, on hospital codes too. So hospital codes like code blue, code red, code white. Good to familiarize yourself with that too. So far, we have talked about the hospital flow of patients and where they typically go, what the units are, and other miscellaneous places, and some tips such as knowing where the stairs are. In the next video for this series, I will review the personnel, like the actual staff besides the OT, because we're all part of the healthcare team. So I'll review and explain kind of what each common staff that you interface with as an OT and what their role is and how they may help you and how you may help them. So stay tuned for that. And if you have not already, subscribe to this channel so that you'll get notified when these types of videos drop.